good afternoon and welcome to our event this afternoon. A special event, harm reduction after lockdown, live stream update for all of you who have tuned in. Thank you for tuning in this afternoon. Wominjeka, my name is Nick and I'm broadcasting to you this evening from the lands of the Wurundjeri people of the Kulin Nation. I'd also like to recognise that we benefit from the knowledge and insights of First Nations people, including their long relationship with plants and the understanding of their many uses. I'd like to pay respect to elders past, present and any young people present today. So, as I said, today's webcast is focused on getting us back out to events, to festivals, to venues and to fields all across Victoria after 6 lockdowns, 262 days in lockdown in total. From punter to performer to service provider, we're all dusting off cobwebs. We're all going to be readying ourselves for some knowns and some unknowns. Among those unknowns are how people are going to take to partying after such a long time in lockdown, because we know that people's lockdown experience has been quite varied. Some people have really taken to the solitude of lockdown and other people have not at all enjoyed it. But we are all going to be joining again at events and festivals. To just take us through a little bit of what to expect, I'm going to hand over to my colleague Bridget Hayes, the DanceWize coordinator. B, what are we expecting for our 21-22 season after 262 days in lockdown?
Thanks, Nick. So I guess it's going to be quite an interesting season coming up. We're not exactly sure what's going to happen because we've never had Downs previously and have had such a gap in the festival seasons like this. So it is going to be interesting and full of unknowns. I guess things to look out for and be mindful of, and things that we're going to be discussing today are that people are just out of shape and out of whack of going to festivals, both as patrons but also as crew. Also due to the nature of lockdowns specifically in Victoria, I think that's really impacted on the gig economy. And so a lot of people that work in the festival scene, so people that work like as roadies, as technicians, as like various crew in management, performing artists, a lot of these people have moved on from the industry, and so a lot of that expertise and experience may have gone with them. So we may see a rise in newer or more naive patrons, but also crew members. So that's, I guess, something to be aware of. And I guess the long-term implications of lockdowns and how that may result on people's mental health and perhaps people's alcohol and other drug experiences too.
Thank you, B. I'd like to introduce now Ryan Czwarno. Ryan is the Director of Public Events, Department of Human Services. And Ryan, I might just cross to you to give a quick introduction of your role and what you get up to. Sorry, Ryan. Thank you. That's a good overview. And I suppose one of the other things that we've got to consider, and probably your team are considering, is that the biggest thing during this whole pandemic has been the strain on our public health resources. And we're still going to be looking at that strain continuing into the future as we learn to live with COVID. What challenges does that provide to us having bigger events and festivals, which also can provide put a strain on our services?
Yeah, the shift into Phase D means that we move away from the focus on daily case count to more about the health system and in particular hospitals. So we have seen a steady decline over the last month in the number of COVID patients in hospitals. But what we are seeing though is a real pressure being placed on Ambulance Victoria and associated private medical providers. So that's going to be the big challenge, I think, for festivals going forward, is the availability of Ambulance Victoria staff to attend festivals, and also, if not AV, but also the private providers who can fill that role as well. So I think that's the big challenge over the coming months.
Thank you, Ryan. The next person I would like to introduce on our panel this afternoon is Julia Robinson, Chair of the Australian Festivals Association. Julia, welcome, and can you talk to us a little bit about your role before we get into the nitty-gritty?
Sure, thanks, Nick. Hi, I'm Julia. I'm from the Australian Festival Association. So we were born about 3 years ago, actually due to the tragic circumstances that happened in New South Wales when there was a sort of a spate of drug-related deaths, and there was no industry body that could respond to the authorities in terms of the application of new regulations that was supposed to be in response to drug-related deaths, but actually largely limited business operations and didn't necessarily address the risks that were societal and larger than just festivals. So that's where we came about, but we're broadly an advocacy body representing festivals and the stakeholders involved in festivals across the country. We've got members across every state and territory.
And you have been running through recently some risk assessment following this almost 2 years of lockdown. What sorts of things can you tell us about that process so far?
Yeah, so this is a new process for us that we're going to be launching annually, but it is an industry-wide risk assessment in the same way that a festival would do a tabletop risk assessment of their festival, but looking at the external pressures that are facing the industry. So we're only halfway through because actually it was pretty meaty, a lot to discuss. But, you know, to the points that Ryan was making around skills shortage, it's definitely the number one concern. And especially in Victoria, where we were looking at 7 providers for medical services at events, for music festivals in particular, that were able to sort of run a proper sort of on-site medical service for festivals. We're actually now looking at only 2 providers that are really capable of providing that service. That was a before COVID thing. And now that we're heading out of COVID and we're faced with shortages across the medical sort of areas altogether in terms of not just first aiders, but nurses, paramedics and doctors that need to be on site, that's a real concern for us, as well as security, which is across the board for every sector. It's really an issue, which does also lead into crowd care and crowd management. The other thing that the risk assessment brought up, which I knew was an issue, but I didn't realise it would be as big of an issue, which is across the board, is around mental health and just the mental health of our crew who are on site, and also the patrons and how they're responding to being back out in crowds, and how their substance use might affect that as well.
And part of this process of working on festivals going forward has been you've been developing a bit of a training package with the Australian Festivals Association. It hasn't quite launched yet, but can you tell us a little bit about what we can expect from that and maybe when it's going to be launched?
Yeah, sure. So I'm not sure if you can share the screen, but I did provide it before. But anyway, it's a really fun gamified version for the attendee, for the patron of a party safe quiz. So it's around drug and alcohol as well as sexual health and safety. It's just really short, 10 questions. It can be used pre-event by promoters to try and encourage patrons to sort of take a bit of responsibility and learn a bit more about their drug taking and alcohol use behaviour. And that can be in exchange for cheaper tickets or access to pre-sales. So a really useful promoter tool that can then help train the staff and really get them to sort of know what they're doing on site. And then there's also another arm that is staff and management and security training. So again, just this identification of when harm reduction sort of applications need to be made as opposed to medical intervention or a security intervention.
And of course, the requirements are different across every state and territory in Australia, so we won't go into the specifics of every state and territory, other than if you are in that state, you'll know what your requirements are. We know that in New South Wales there are slightly different requirements than there are here in Victoria, where we're broadcasting from. We have a bit of a special treat for you as well. We've got a musician here in the Harm Reduction Victoria boardroom, where I'm broadcasting from. RP Downie is our musician who you're hearing from a little bit in the background. We're going to take a short break and hear from RP Downie, robertdowney.com, and I'll drop that in the YouTube chat as well. Thanks for joining us here, and stick around and we'll be talking more on harm reduction after lockdown.
We can't hear the other speakers on Zoom. Apparently it's coming through the YouTube channel. We can hear it on the Zoom, right? It's not coming through the YouTube channel.
Right. And we can't see them either, because I thought you were going to be putting the links.
They're all coming through fine.
No, I mean on YouTube, like putting it through to through the Black Magic.
I can see we can check here to see what they're coming through on the YouTube channel. But can I just move it in his screen sort of first? Can we just
Oh, they can't. After lockdown, a live stream update for you. So I'd like to introduce our next guest now, which is Jeff Moss from Sound Event Group. Jeff, could you give us a little introduction and talk to us about your role?
Yes, thanks for having me. I run several multi-day and single-day music festivals across all three different states of Australia, basically. I'm in a lot of contact with people who are on the ground at these events, from statutory authorities to punters to suppliers to staff. I work closely with organisations like DanceWize and stuff to establish best practice at the events to ensure that patient outcome and patient safety is number one. There is a little bit of apprehension at my level, I guess, with this transition over this summer, which is going to be from the old ways to the new ways, so to speak.
They still come, Jeff.
I believe that there needs to be a bit of discussion on being active and not reactive. So it's great to see and hear of things like Julia's little app that that they're putting together for patrons to fill out. There's going to be a lot of younger people there at events for the first time. I think if we're not active and we're just reacting, it'll just put too much pressure on the local amenity and statutory authorities because we'll just be utilising all the resources we can, which are already stretched. So I think, as I say, all those amazing things that Julia's suggesting and being active and getting these people prepared to go to an event, prepared to go to a music festival, will really relieve a lot of the backhand stress with the emergency services and stuff like that. So I think that's a healthy discussion moving forward. And I almost think it would be great to not have a blank canvas, but learn from some of our hardships over the last 20 years of music festivals and rewrite a few of the rules.
Excellent, thank you for that, Jeff. And just quickly, what sorts of challenges do you yourself see just as we're moving out of lockdown and back into events? Some unique challenges that perhaps we haven't discussed yet.
First and foremost would be people not feeling safe to seek help, just for the fear of, will they have COVID? Will they be the zero, patient zero spread, or will they get the appropriate care and things like that? I think a lot of people might be fearful of putting stress on emergency services. There's a certain empathy out there at the moment, which is a beautiful thing for the emergency services. I think there'll be some, getting the double vaxxed stuff streamlined at front gates and stuff for events is going to be quite an achievement. And just looking and as an overall perspective at events, making sure that they're not perceived in the wider public as spreaders, or there's none of those words are used and associated with events, because I think that the arts industry, music and arts, obviously is integral, and it should be supported as such and not demonised if something does happen now.
No, absolutely, especially since I'd say the arts and hospitality industry has been one of the hardest hit over our lockdowns and one of the slowest to be able to get back up after our lockdowns have been lifted. So we really need all the support that we can that we can get, and we hope that that support continues throughout all the tiers, whether it's government, whether it's the popular and mainstream media. We hope to see support, because that's what we need right now. I'd like to introduce our next panelist, and thank you very much, Jeff. Stick around because we've got a little bit more to go. Our next panelist, Professor John Fitzgerald. John does drug market research at the University of Melbourne. John, would you like to talk to us a little bit about what you get up to?
Yeah, look, thanks. I just wanted to say thanks to everyone. We were going to get Monica to speak to some of the trends in the impact of the lockdown on drug markets, but unfortunately Monica can't be here. She's quite ill today, so I'm sort of filling in for this. And we were going to look at some material that was coming out of some survey work coming out of ndarc that was presented earlier this year. But look, I might just speak briefly to that, to some of that work. I won't do the kind of researchy thing and do a PowerPoint, which would just be terrible. So I won't do that. I'll just speak briefly to it. But I think one of the key questions that I certainly would be interested in, and I'd really be interested in other people's perspective on this as well, would be, the key question would be, do you think people will be more inclined to use drugs and more drugs coming out of COVID-19 restrictions? Or not just more drugs, or more hazardously. Because not just in terms of what they're interested in doing, but because of the circumstances that they're in. And what I thought I would do is that we recently did some work during the lockdown in Victoria, where we monitored the drug market, and we were particularly interested in what happens to a drug market when COVID-19 restrictions are put in place. And the premise was, when you actually restrict people's movement and the movement of the drug market, what happens to the drug market itself? And this was because we noticed when we were doing monitoring the drug market at a music festival in Melbourne in March of 2019, we noticed that there was just very, very little ketamine at this particular music event. And it was actually at the same time that the Wuhan lockdown was on. And we just thought it was an incredible coincidence that there was, a lockdown going on in China and there was no ketamine at this festival. It's just an incredible coincidence. Anyway, we got us thinking that actually we should be monitoring the impact of lockdowns internationally. We should be looking at what happens, what impact that has on the drug market in Victoria. And that's what got us to monitoring the drug market in Victoria during the lockdown during 2020, which is what we did. Anyway, it got us thinking more broadly about actually just reviewing what was the impact of the lockdown. And generally, when I just sort of sat down and looked at the review, this was the kind of general picture. And what it was that we noticed that there were small reductions in drug use of some substances, and that was mainly because there was less opportunity for social interaction. And that was based on a lot of survey work. There was also a reduced opportunity of drug market activity. So there was less movement of people, less movement of drugs. So that meant there was less drug market activity. There was an increase after lockdown at the end of 2020. There was a really marked increase in alcohol consumption and an increase in cannabis consumption. And that was reproduced not just in survey work, but also in the monitoring work that we did in wastewater analysis in Victoria, where we saw really big peaks, really big sharp increases in alcohol consumption and in other people's work in cannabis consumption as well. We also saw really sharp spikes in MDMA consumption and meth consumption that was seasonal. So end of the year, around Christmas time, we saw really big spikes in MDMA consumption around this time last year. What we also saw in Victoria in particular is that we saw the introduction of new drugs into the market. and we monitored in a number of different places around Melbourne the drug market in a couple of different ways, and we actually saw the introduction of some what they call synthetic opioids. So things like fentanyl and things like that, but we actually noticed that there was a new drug introduced into Victoria that we hadn't actually seen anywhere in the world before. And it was this thing called U10, beta-U10. It was a fentanyl-like drug, and it had never been introduced into a drug market anywhere else in the world. We were the first ever, and it was introduced in September 2020. It lasted about 6 weeks, and it was introduced in North Richmond. And it lasted about 6 weeks when heroin became incredibly hard to get. And then when heroin came back on board at the end of October, then the U10 disappeared. It was a flash in the pan, and we were lucky that it was not a very powerful drug, but it was a really good example of what happens when drugs become scarce, that new drugs get introduced into the market. And so these are the sort of dynamics that we anticipate in drug markets when lockdown conditions get introduced, that you get changes like this. And so this is the kind of, you get substitutions, you get combinations, you get people mixing and matching, and you get dealers introducing things that they haven't introduced before. So these are the sort of things that we anticipate.
That's really interesting on that point about substitution. Maybe like a little bit of an expansion on that, because some people might be hearing that and thinking, "Oh my gosh, there's completely new drugs being introduced in Melbourne," and especially for some, they might recognise North Richmond as being a bit of a trigger point with other services being provided in North Richmond, and worrying there that's the cause of it. So maybe can we talk a little bit more about substitution and about the fact that you are preparing for these things, because I think it does go to show as well that prohibition doesn't stop supply from happening, because there are always other things out there, and people will just look for something else, something similar, something completely, as long as they can change their state of mind.
Yeah, and look, and the main thing is that the main message is that the drug market is very adaptive, and what happened as soon as heroin became more available, that drug disappeared. And that particular drug is not particularly dangerous in the sense that there wasn't an increase in overdoses, there wasn't an increase in harm at the time when it was introduced in Victoria. And so we shouldn't get overly worried about that particular appearance of that particular drug. We haven't seen it, we've only seen it appear in Queensland and in WA in short bursts. So these are very small indications about what happens when restrictions are placed on drug markets. But there are other things actually that now that we're actually lifting restrictions, there are other things that we really should be looking at that are really important for this summer. And I think I've got a list here. So when we ask the question, what are the conditions that are going to impact on whether people are going to change their pattern of use around this summer festival? I've got questions like, well, are they going to be able to spend? What's their access to income going to be like? Well, during lockdown, we had government actually subsidising them. Well, those subsidies no longer are going to be there. So are they going to have a lot more disposable income? Well, that's not going to be the case. Are they going to have access to drugs? Well, we actually don't know whether the supply to drugs is back on. We know that the supply to methamphetamine was actually very low during lockdown. That it was quite difficult to get methamphetamine in many parts of Australia. So we don't actually know whether access is going to be easy in many parts of Australia. Do we know whether people are going to be able to get their drug of choice? Whether people are going to be interested in the same substances that they usually would be? The surveys are not clear on that. Do we know about the changes in purity and price? Well, some of the survey work that's being done in Victoria would suggest that the prices for some drugs actually went up as a result of lockdown, and the purity went down. So these are things that would suggest that it's going to actually not be easier for people to use a lot more drugs. the mode of delivery. Is it going to be easier for people to get access because the delivery mechanisms are easier? Well, that's not necessarily the case. We're not sure about that. We just don't know. And finally, what about the policing? Police are in the mix. We don't know how important they are in terms of, what impact they have on people's access to drugs. But in some contexts they are important, some others they're not. So we're not quite sure about that as well. There are a lot of unknowns. And so I'd be really throwing it back to the panel about within the context of festivals, within the context of this summer coming up, what do they think? What do they think? So I'm sorry, I haven't got very many good answers, but this is the best we've got at the moment. What does the panel think about, what does their gut say to them about some of these questions about what can we anticipate about the use of illegal drugs this summer?
Is there any panellists who would like to comment?
Yeah, I think it's actually very healthy information, John, because it seems to me that patrons may have more choices than ever in terms of financially what sort of range can they spend if they choose to buy drugs. There's different types of drugs, and that just leads me to really going back to my first point, the things that Julia's implementing with the apps and the DanceWize education is to get to these punters before they get to the event, the information spreading, sharing. So they may have a bit of a decision in mind before they hit the heat of the moment, which is where the decisions can be made, not necessarily based on what they've already planned, but because they're excitable in that moment, and they may make the wrong decision. So people do, information has been passed on to people in the last 2 years like never before, and people have adhered to it and they've educated themselves on a range of issues. I suggest people would do the same when it comes to drug consumption, and the more we get to them before the event, I think the better it'll be for decision making.
Yeah, only just to say that's exactly right, Jeff. We just want to reach people before the time that they get to the gates in whatever way that we can. And we think that by incentivising that with something that is interesting, which is access to pre-sales or a VIP upgrade or whatever it looks like, can get to people when they're making these decisions and they're planning for their weekend, planning for their festival. Just try to arm them with that information that, it does seem, as we all know, there's a lack of accessible information out there, certainly in the mainstream as well. Obviously we've got great services like DanceWize, but there are also just mainstream blockers to some of this information. So just getting that really digestible information out there. Like the quiz that we did is really dead simple, but there are some catches in it. Like we're definitely trying to make people think, like there's some questions that you would answer and you'd be like, oh, well, of course it's, one of the questions is, does cocaine help you sober up? And of course, everyone's going to be like, oh, well, yeah, doesn't that happen? But obviously the answer is like, and it sort of explains what the answer is. But so just trying to catch people, trying to make people think, trying to make people laugh, and just giving them that moment to sort of have that extra kind of, oh, well, maybe I should just think about that. And like, I don't know, climate change, like things are getting warmer, like the heat obviously had a huge impact on our summer in 2018, 2019. And, that does actually increase your risk. And it's not just about bushfires cancelling your festival. It might be that the festival, is just going to be really hot, and maybe you need to start sort of planning for that. So, for sure. I think that's the whole reason why we did it. It's a tried and tested model that some of our board members had already been doing in the past. We've just made it, as I said, gamified it, and also armed the staff and the crew with some really kind of frank and fearless kind of just information about drug use and just trying to, educate, as opposed to get to the end part where we've got the issues where we will be faced with skill shortages, we will be faced with kind of medical problems with paramedics and things like that. So try and get in, as well as we can beforehand. That's any good risk mitigation process, is to sort of find the problem, see how much we can, cut them down, even if it's shaving it off by 5%. It's still risk mitigation.
It's good to mention, you mentioned cocaine there as well, because one of the things that we did see over the past 18 months was Melbourne overtaking Sydney in cocaine being its its popular drug, and just anecdotally as well, we've heard that cocaine has become a much more popular drug over the past few years, and with it comes its own set of risks, which, as you sort of alluded to there, Julia, are often missed by even people who are a little bit older who just don't realise the risks of this drug. And this goes back to, looking back at the way that our drug education happens or doesn't really happen in schools. There's a whole systemic issue here with our drug education, but that's a broader issue. We want to talk a little bit about communicating on drug issues that are out there, and how to communicate with punters, and we're going to talk about that in just a tick. This is Harm Reduction After Lockdown, a live stream update, and we're going to be hearing a little bit more from RP Downie, who you are hearing from in the background at the moment. robertdownie.com. I'll drop that link in the chat if you want to find out more about what he does. Thank you. sticking with us. We are talking harm reduction after lockdown with our guests, Professor John Fitzgerald, Ryan Czwarno from the Department of Health, Julia Robinson from Australian Festivals Association, Bridget Hayes, the coordinator of the DanceWize program. RP Downie has been doing our music. Jeff Moss is from the Sound Event Group. And I'd like to introduce our final panellist this afternoon, Isabelle Volpe, Research Fellow at the University of New South Wales in Sydney. Isabelle, you're involved with a little bit of research around communicating about drug issues. Can you talk to us, introduce yourself and talk to us a little bit about the sort of work you've been doing?
Hi. So, my work around alerts is at RMIT. So I work as a researcher along with Monica Barrett, who John mentioned before was hoping to be here today but couldn't come along. So basically what we'll be looking at is how we can use or design drug alerts for harm reduction purposes. We've learned quite a bit from it. So I'm kind of just hoping to share some practical things that might be helpful for people who organise events and promoters and that sort of thing. So I guess the first thing to say is that, we've seen that in the last few summers, especially prior to COVID, there were some pretty high-profile cases of deaths and serious harms at clubs and festivals, and those were often in cases where people were taking drugs that were unexpectedly strong or contained another substance they weren't expecting. The good news is that we're seeing more and more projects that aim to mitigate these kind of risks by sharing information about high-risk drugs. So John Fitzgerald is doing some great work around this. We've also got a great project called the Prompt Response Network, which is in development. And the one that you might have seen is that state health departments are starting to put out drug alerts that are based on information from things like hospital presentations, toxicology, findings and police seizures as well. However, there are some challenges of putting out these alerts effectively, and this is something that we found in our research on designing drug alerts. And I guess two things that are really relevant are, one, that we can struggle to get the information out to the people who need it the most. So that includes people who might be taking drugs at events and parties. They might be a bit out of practice, and they might be exposed to risk factors like hot and crowded environments. And the other thing is that when we do put out alerts, we need to make sure that people take them seriously. Of course, they need to know that it's relevant to them and they need to know what to do. So basically, event organisers and promoters are crucial in overcoming these challenges. We recognise that you have a relationship with your patrons and with your community, and with that relationship comes a certain level of credibility. So in a way, sometimes we play the naggy aunt and you're the cool aunt, and they know that you want them to have a good time while staying safe, and that really means that you're a crucial part of this harm reduction puzzle. So I had a bit of a think about what practical things you can take away to do to get your alerts out to your patrons. And I think the first thing is pretty straightforward. It's share the alerts. So the health departments currently share them on their websites. And then there are also harm reduction organisations that translate the government alerts into more digestible alerts for people who use drugs. So organisations to look out for are DanceWize, NUA and the Loop Australia. That's it. If you Google them, you can find their social media handles. So please do check them out. And a repost goes a really, really long way in reaching the people who most need to see them. The second thing is take advantage of how well you know your community and the context in which they're going to be taking drugs. So you can take advantage of your knowledge to communicate important information from the alerts with them. As an example, are your toilet lines long? Probably. Put flyers up so that people can read them in the line, or you can pop them in the Loop. I helped to put together alerts for the Loop, and I can definitely say that we'd be happy to help make flyers for you, and I'm sure that DanceWize and UL will feel the same as well. And then the third thing is use the alerts as a learning tool for events as well. So event organisers obviously have plenty on their plates, we know that, and that's why harm reduction organisations try to make alert advice as easy as possible to action. But there are things that you can do to help out as well. So as an example, alerts that are related to strength of MDMA often talk about risk of overheating. It's all well and good to tell people to not overheat and to stay hydrated, but you can help them to action that without necessarily making them read an alert. So as an example, a rule of thumb for water consumption on MDMA while you're dancing or exerting yourself is to sip 500 mils of water per hour, and that's a pint glass approximately. So at your water station, you could be providing a pint-sized glass and a cute little sign that says something like, "Have you had your hourly pint of water?" Just a nice little nudge that helps to disseminate the important information that's in the alerts. And I guess just to kind of drive it home, there are some benefits to consider about disseminating these alerts. The first thing is for patrons, obviously, it alerts them to particular substances of concern that might be circulating, and it also gives them practical advice on how to reduce the risk of harm, including what kind of warning signs they should look out for in themselves and also in their friends. Second thing for staff at events, especially for staff working in health and welfare, for paramedics and security staff, it lets them prepare in advance for how they're going to handle any unusual presentations that they might be dealing with. And also, more broadly, it helps to build a culture of harm reduction and caring for each other. We can all work together to do that. And we can make it something that becomes automatic. Like when you prepare for a festival, you check where you're camping, you pack your camping gear, figure out how you're getting there, you check the weather forecast, check for drug alerts, and you chat with your friends about how you're going to stay safe. And we can all build that together.
And one of the things that's really important before we get to a point where we need to be alerted is that people need to know about the substances that they might be taking in the first place. And that's where DanceWize here in Victoria, that has 25 years of experience, in New South Wales, going on nearly 5 years of experience, have really specialised in developing and disseminating resources. And I might ask B to talk us through some of the resources here that I have, colourful resources in front of us, newly redesigned. And this is really the first port of call. We don't want you to, an alert to be the first port of call where you're alarmed about a substance. We want you to come at this before you decide to even take a substance and learn about these different substances so that you're armed with knowledge, because knowledge is the key to harm reduction. That's what we want first and foremost. B.
Yeah, sure. So at every festival that we attend and other events such as going to schools and things like that, we'll have our substance-specific brochures on all different types of substances that may be used, usually within festivals or party settings. Some other substances as well that may not be as traditionally used in these kind of environments, but are still things that people may be using. So you've got things like LSD, benzodiazepines, we've got ice, MDMA, and so we'll have information all about like the long and short-term effects. We've got things like the half-life and also some harm reduction tips for using these specific substances as well. Coming out of our gender-based violence service, we've also got a few different resources. We've got the Just Say No. This is one of our resources about checking substances before using it, and our grounding information as well, which is quite relevant, especially coming out of lockdown, when people may be experiencing more mental health issues or just a bit more fragile than when they were, I guess, interacting in the festival space a lot more regularly than they have been recently.
We have videos to support those images that B was just holding up on our DanceWize YouTube channel. So please do subscribe to the YouTube channel if you haven't already, and go and have a look at those after our live stream is finished. But John, maybe I just want to cross back to you talking about last year's results. We talked a little bit about the drug consumption data before the break, but did you want to talk to us a little bit more about last year's results?
Yeah, look, we actually didn't talk about the festival results. What we did at festivals was we did some slightly different work at festivals. What we did was I was working with Gavin Reid, who was working at Bio21 at Melbourne Uni, and we got some pilot funding to develop up a technique where we collected up the plastic Ziploc bags, and we at events we would collect up to 500 of these little plastic bags, and during the course of the event we would collect them and we would collect up the residue inside the bag and with a little cotton wool bud, and we would wipe the inside of the bag with a cotton wool bud, and we could actually use even what was not visible, the residue that was not visible, we could actually put it inside the really sensitive equipment that Gavin has got, and we could test the residue for the presence of whatever substance was in that plastic bag. And over the course of the night, we could give updates every 2 hours to the event management, and which would then let them know what was being consumed over the course of the night. We did this, we only did it at events where the management wanted us to do that, and again, we integrated with the event management team, and it gave us the opportunity to provide a kind of early warning system for the event. If we came across, we gave updates on what was being consumed at the event, and we relied on the branding on the bags. So if the bags were branded Superman bags or Green Aliens or whatever the bags were, that it gave us an opportunity that if there was something that was particularly nasty in the bag, if the bag was branded, then we could actually give a warning about the bag. So that's the best we could do in the current conditions. It was the closest thing we could do to pill testing in Victoria at the time. We did do occasionally, if there was an opportunity where we came across an intact pill or an intact substance, then we could test that. And we did do that on occasions, and where at Beyond the Valley we gave out a warning in 2019-20 for a UPS pill which contained N-ethylpentalone. And if people were at that event, they would have gotten a warning at that event over the local socials at the event, and that was us. We did the testing on that particular tablet, and that contained N-ethylpentalone, which was a particularly nasty substance that has been responsible for a lot of overdoses, and that was our testing that was done at that event. So we did a lot of testing over, I think it was, I can't remember how many events we did testing at, but eventually we got to the point where we were able to put the really sensitive equipment in the back of a University of Melbourne van, and we were able to put that van at the event, and we were able to do that at an event in Flemington in March of 2020. So we were able to basically do on-site testing, and I think the equivalent of what they talk about that is kind of basically population-based testing. So we weren't doing it for the individual, we were doing it for the population of people at the event. And so that's what we did. And that gave us the potential to actually give feedback to the event management about what was being consumed and if there was any particularly nasty things.
And as I said before, knowledge is the key to harm reduction. The more information that we have, the easier it is that we can reduce those harms by providing information on what would happen if you consumed that substance, or saying, hey, that's probably not a substance that you would want to be consuming in the first place, especially if you think that X is Y, and that's not what you want to be taking. Just want to say a big congratulations right now as well to our friends, colleagues, brothers, sisters, cousins, etc. across the ocean there in New Zealand who have just legalised pill testing. They will now have services, drug checking services operating legally at festivals, pop-up clinics, university, orientation and other locations from this summer and beyond. And they always seem to be just a little step ahead of us on a lot of these things. So congratulations, New Zealand. As Isabelle mentioned, there are a few services here in Australia, like the Loop. There's also Pill Testing Australia, who have run 2 successful trials in Canberra at Groove in the Moo, and there are plenty of people who want to see these sorts of services available. As John has touched on, there are many different ways to do this as well, from a behind-the-scenes focus to a more front-facing consumer focus. That is a much broader discussion that unfortunately we don't have the time to delve into today because we are nearly at our hour. But before we finish up this afternoon, I just want to cross back to each of our panelists and give you each an opportunity to perhaps express your wishes for this season, maybe some, since we have had 2 years of a lot of public health policy focus in other areas, what are maybe some of your wishes for public health policy going forward in relation to festivals and events?
I'll stay in my lane, and that is in the COVID public event space. And to me, I'm just really looking forward to the return of festivals and the live music scene. I'm missing concerts as much as anybody, so I'm just glad that we're at a point with our vaccination rates that we can return to something that is as close to normal as possible under this pandemic.
Thank you, Ryan. Jeff?
My sentiments exactly. I think everybody's super keen to get back into the groove with festivals. It's very healthy to maintain these discussions about how that's going to happen as safe as possible, not just for the patrons, but for the reputation of the arts and music industry as a whole.
I'm excited to get back to it, but also cautiously optimistic, I guess, and just putting the disclaimer on that, it's we have to just all be very mindful of everyone's clustered events at certain times of the year. Everyone's just saying yes to doing things, but the risk is that it does lead to something negative happening. So I think we just all need to be mindful of that and take our time. And I think in Victoria, we've been very lucky in a way to have been given an insurance policy recently, which I think will allow some of that to happen a bit more safely. A bit of a roundabout way of saying I am excited, but I'm cautiously excited because I think we all need to have that little asterisk on us at the moment.
I'm hopeful that we can take some lessons from COVID and how we've dealt with COVID. I guess just thinking about the fact that nobody wants COVID here. From a health perspective, we don't want the health risks that come with COVID. And it's understandable that a lot of people don't want drugs in the community, but they're here and they've been here for a long time. With COVID, we've learned to manage risks. We can do things like implement distancing, we can be vaccinated, that sort of thing. We can arm people with information, and we can do the same thing for drugs as well. And as Jeff was saying, I think this is an opportunity to reset a little bit and shift our thinking. And keep people safe, knowing that people will continue to take drugs, but mitigate risks as we can.
So touching on what other people have said, and just really highlighting, I guess, the need for specific harm reduction services within festival spaces and other events, just having, practical things in place, such as having chill-out spaces and care spaces, having more access to water throughout the festival and campsites, having additional roving crowd care services, and trying to implement trauma counsellors at as many events as possible, just trying to get all these practical aspects that would just make our festival safer and honestly just a more enjoyable party if everyone's having a good time and not going into distressing situations.
Thank you, B. And finally, John.
Yeah, as the dad of a new graduate from high school this year, I'm particularly interested to try and make them as safe as they possibly can. I think Jeff said to me some time ago that the most important thing is to make it make it a really patron-focused experience. And as much as each of us really want our thing to be the most important thing, I think at the end of the day it's their thing, and I think that's the most important, is whether it's substances, whether it's the performer, whether it's the sound, whether it's whatever it is, it's actually their experience, and it's our job to make that experience a great experience and not the last one. And I think that's the thing that I take home with me every time. And I think that to me is the thing I really hold dear. And I think if we can make that the focus, then I think we're doing well.
Thank you, John, and I'd like to again thank all of our panelists who have, I guarantee, been with us here this afternoon. First of all, Professor John Fitzgerald, who's sitting right next to me, Ryan Czwarno, who is from the Department of Health, Julia Robinson from the Australian Festivals Association, Bridget Hayes from DanceWize here in Victoria, Isabelle Volpe, who is from RMIT and working on drug research there, Jeff Moss from the Sound Event Group, and also our musician, RP Downie, who you've been hearing from in the background. Special thanks to John, who has put this together, and Ned as well, who is behind the buttons and has been looking after things. So thank you, everyone. This has been Harm Reduction After Lockdown, a live stream update, and we hope to do more things in the future. Certainly a learning experience for us, and we hope to bring more information in a much more coherent way for the future. Thank you. Bye-bye.